Yeah, I'm Gosio Diego Samson, and today we'll be talking on infant mortality. It has been a pandemic and a serious issue to world leaders, so I'm going to talk on it. And welcome to my webinar on infant mortality. And I have a short story concerning infant mortality. It wasn't until my wife went into maternal labor that I had a first-hand experience of infant mortality, that I could truly understand the pain and the trauma mothers experience when they lost a baby. A mother who was next to my wife in a postnatal ward in the hospital, came out from an emergency room crying. When I inquired, I was made to understand that she has just lost a baby. She had born a few minutes ago due to negligence from the nurses on duty, and this led to the woman into a coma. So this thing really make me this experience really caused me to think of exactly what is infant mortality and what could be the cause of infant mortality. So infant mortality is the death of a child before his or her first birthday. And infant mortality rate is the number of infant deaths in every 1,000, and as such, it gives a key information about infant and maternal health. So in my next slide, I'm going to talk about the main causes of infant mortality. These are the main causes of infant mortality: birth defects, low birth weights, as in a baby born premature or there's no weight. Then injuries like suffocation, sudden infant death syndrome, maternal pregnancy complication, diarrhea, pneumonia, and lower respiratory infection. So like this, in the case of lower respiratory infection, it talks about diseases that can block the baby's airways, that will make the baby not to breathe very well. And maternal complication, probably in the process of maybe cesarean operation, or something, maybe negligence from the part of on the side of the nurses or the doctor on duty, that could also lead to maternal pregnancy complication. So these things are some of the causes of infant mortality. Now let's also look at call to action. What could we do to prevent infant mortality? These are the main major things I've highlighted that could help to prevent infant mortality. One is exclusive breastfeeding. Exclusive breastfeeding of an infant. Prenatal care. This breastfeeding should last up to 6 months. Here in Nigeria, we call it baby friendly. Then a prenatal care. The woman should undergo proper prenatal care. Then proper clothing for an infant. One of the causes of infant mortality is pneumonia. So if the baby is clothed properly, it will also reduce infant mortality, because it will not have access to cold that will enter our ribs and all those things, our lungs. Then preventing birth defects is also very important. Addressing low birth weights and preterm birth. Low birth weights probably could be from diet from the mother, the pregnant woman, and the woman need to eat well to prevent low birth weights. Then take proper medication, proper vitamins and mineral. Then this preterm happen like before the probably like 8 months of pregnancy, or some comes 7 months of pregnancy. So things like this need to be addressed. Then vaccination for the baby, very important. Vaccination for the baby, that is immunization, is very important for the baby. Then keeping the environment clean and safe for the newborn baby. Yes, it's very important. Things like this should be avoided. The baby should not go close to electricity or things that could harm the baby, like sharp objects, anything that could harm the baby. Very important. And proper medical checkup, regular medical checkup is very important. Thank you. See you next time.